Great. Okay, let's kick off. Well, welcome, Tera Hurst. Thank you so much for joining us. And for those that are joining online, and for my friend here joining us in person at the Kennedy School. It's been a long time coming, and I know it's the end of term, so we're very grateful that you guys have joined. We've been wanting to talk with Tera for a long time. So it's so good that we've been able to make it happen. So we'll talk for 30, 40 minutes, largely delving into the kind of history and undulation of drug policy in Oregon. But it's been, amazing to do a bit of digging into history, Tera, and see your interest and passion in this field. So it's going to be a really great opportunity to understand the kind of evolution of really a kind of world-leading drug policy reform and the challenges that exist there. So yeah, thank you so much for joining us today.
Yeah, I'm glad that I was finally able to do it.
Amazing. So perhaps just kind of delving into a bit of background on your bio, you mentioned in public that you have your own experience with addiction and recovery. Was that the thing that led you into this work, or how did you come to do this work today?
Yeah, I think that it was partially, I mean, of course, it's my personal story that kind of leads me into my passion for this work. I honestly didn't think that I would be able to work on something that was so close and personal to me until really, it wasn't until I ran for city council in 2020 and talked about my recovery in a much more open venue and recognized how important it was for people who have this experience to really be in places where we're making policy, because a lot of folks don't understand the implications of, at that time they had just closed a sobering center in Portland, the only sobering center in Portland. And unless, not always, but unless you kind of understand how important those types of services are for somebody on their path, it's hard to kind of just not see it as a budget line item. So for me, it was really about both my personal journey, and then I've been in politics for 12 years. And once I saw that I could handle it without just like being kind of a mess, I dove in.
Amazing. So I think it would have been 10 years ago, I actually went over to Portugal and met with Yao Gulau, who sort of maybe has a similar position there that you do in Oregon, and talked to him about, how they were able to get those reforms and decriminalization through, and, very successfully. And that kind of went, and from what I've heard, it sort of led the world in this way. Tell us about Measure 110 and how it kind of came about, and what was the Overton window, or the kind of political realities that made it a possible thing in Oregon?
Yeah, so Measure 110, and to be fair, I started kind of professionally working on this once it passed. But ultimately, what was happening in our state and in our city was very similar to a lot of American cities. We were reeling from COVID and the pandemic and seeing the kind of health inequities exposed at a level that I don't think many of us had not. We were experiencing, Portland was the 100 days of protest, and it was so impassioned that even our, he was ours, Damian Lillard of the Trailblazers led some of those, the kind of a protest across the bridge where we all laid down. So there was a lot of emotion, raw emotion around how law enforcement was not only the wrong tool, but also a really harmful tool, especially to communities of color. And there was this desire to do something about it. At the time, we had in 2017, Oregon defelonized drug possession. So everything dropped from a felony to a misdemeanor. And so the next step, obviously, is to get it from a misdemeanor to a citation. And, after probably about a few years of working with stakeholders in Oregon on the ground, which I was not a part of, they came up with the policy. And, right when they were turning in the signatures needed to get it onto the ballot, the state shut down. And so they weren't able to actually do what you would call a traditional campaign, which I was facing during my city council campaign. So it was a very strange time to be running. I'd say that just as we are feeling a lot of this kind of war on drugs rhetoric coming back into fashion this political cycle, that political cycle, people were really reckoning with the racial justice and how do we respond to tragedies like George Floyd. And so it passed overwhelmingly in Oregon. It was by a margin, it was at 58%, which is huge. And, our progressive DA in Multnomah County also won readily by 75% that year. So we were really in a place where we're having good conversations with voters around, do we want to treat this as a healthcare issue or a criminal justice issue? And how do we repair harms for communities who've been most harmed by the war on drugs?
And there was it's so not only passed there, but the mechanism, if I understand correctly, and correct me if I'm wrong, is a significant package of investment into treatment as it wasn't just the legislation that changed, but also this investment with quite an innovative thought around the extra revenue that came from cannabis that would go directly into these services. So it's new money, directly moved across into this area. What were your kind of thoughts around that? And do you think that was designed well?
It was designed, yeah, I think it was a really important and smart move. So you decriminalize simple possession, it moved down to a Class C violation, and then it basically took anything over 90 million per biennium and put it into this drug treatment and recovery fund, something like that. And that fund was overseen by the Oversight and Accountability Council, who is made up of predominantly people with lived experience, both, not just the executive directors of a treatment center, but your peers working on the front lines who both have experience in the criminal legal system as well as with their own struggles in addiction and with harm reductionists and researchers and addiction doctors. So it's such a unique council that normally, our Alcohol Drug Policy Commission is stacked with, judges and law enforcement and sheriffs. And now we had the right people around the table making funding decisions. Oregon, also, the other landscape is that we were dead last in access to care and second in the nation in highest addiction rates. So we were worse on both. And then you hit COVID, which eviscerated our treatment system. And so it was really about trying to stop the bleeding, quite frankly, within the system, and then expand and being able to offer more services. The other innovative part of this is that it wasn't just going to kind of Medicaid reimbursable services. We're talking about harm reduction. We were able to expand harm reduction. We were able to really, invest in Narcan and naloxone at a time when fentanyl was just coming into our systems, and housing and transitional housing. So, if you got out of withdrawal management and you didn't have that next step, we were able to connect them to 6 months of housing that was paid for by Measure 110. So it really kind of blew open the treatment model and was flipped it upside down and said, we are going to trust the community providers to tell us what they need, and we're going to give them that. I mean, there is a lot more to it, but that's kind of the basis of it. And what we found is over 159,000 services have been delivered since this went up. And basically the money didn't actually go out until 18 months later. So that was part of the problem with implementation. I think people forget that the health authority was also trying to grapple with a pandemic. And we also had an overdose crisis. So there was a lot going on. But once we got the money out, providers were able to stand up services, and a lot of them are culturally specific and linguistically specific providers who are really meeting the needs of their community.
And it seemed like, I mean, just to the point of fentanyl, I think that's probably makes the environment different to Portugal. You know, you have this very clear healthcare crisis that's happening, and not one that Portugal had to deal with. And the other one that I'm really curious about is the citation process. I'm kind of looking at a lot of the the news and some of the reports around it is these police officers that have gone from using their guns to this piece of paper, and you see almost they're kind of holding this paper weirdly, like this is what we have to do. Was there training invested into that interaction, between what I mean, there's a real power shift in, and like how was there thinking around that, or what sort of happened there?
I think that was a big downfall. And I will lay most of the blame on the executive branch because it's ultimately their role to implement new laws and to bring the right stakeholders together and to make sure that everybody has what they need. But I also think that, like, moving forward, it's really important to have law enforcement at the table. So instead of just saying, we don't want you doing this, it's how can we start taking this away from you so that you can focus on other things and that will actually work on the ground, right? Because once you start having those conversations, you're able to design a program that would work. What we had was they never actually created a uniform citation. So that means, for those of you who've actually gotten a speeding ticket or anything else, you would just type in a code and it would show, the code would basically show up, oh, it's a Class E violation for possession, but it doesn't tell the person who's getting the ticket, here's the number that you can call to get your needs assessment and to be able to get connected to local community care, recovery is possible, like all of the different things that you could put on there that would be really helpful. And so I think that ultimately that was a failing, and it was also a problem because it was a benchmark that people were holding this whole policy to, when ultimately the point and the voters' intent was to get it out of the criminal system, right? That they don't want police officers to be social workers. And then the only metric people cared about was these citations and whether or not they worked. And the state didn't put any education dollars into, here's this phone number, here's a hotline, here's how this works. We were never trying to design a system where you had to get a ticket to get into healthcare. We were designing a system, if we build out more healthcare, will people access it? And the answer is yes. If you are seen possessing drugs, police can hand you a ticket and say, we need you to call this number. And hopefully that would be the connection that this person needed to basically get deflected from jail. But that system just never was actualized. And, again, I think it's important to look at the context we were in 2020. We had the feds in our streets during the Trump administration, the Trump leaving. Police weren't, having dialogues with law enforcement at that point was not going to happen either. So it was a fraught time to try and bring community advocates together and police together to find solutions as well.
And it seemed like, I mean, there's been a lot of studies around, like and opposing perspectives on increase in rates of addiction and overdose. So it's sort of a mixed review there. Do you feel like the policy, like in a way, and we'll kind of go into the sort of the recriminalisation bit now, like, was it set up to, like, there was a general population that agreed it should be done well, but then it wasn't implemented to a fidelity that would have meant it would be successful. And then, the implication of that was there's these sort of large groupings of people that are consuming drugs, and then that becoming a real scapegoat, I guess, for changing, to change the policy. Was there early signs of that happening, following the Measure 110? Were there key people that started banging a drum about it being not the right approach?
Yeah, sorry, my son just came home and the dogs barked. Yeah, I mean, I think that, I think everybody, when thinking about Measure 110 and implementation, it's important to just bring yourself back to those kind of mid days of lockdown and COVID. And remember all the things that were happening. We didn't know what our, healthcare system is. We didn't know if we were gonna, if our healthcare system could handle this. We didn't know if our economy was gonna continue, right? There was so much happening that we were focused on this one law to try and get it moving, especially because we were hearing from addiction specialists that they were gonna have to close their doors because they were not able to respond to the crisis that we had. So I think there was plenty of warning signs, but those warning signs were for everything, right? They were for a pandemic. They were for our state was on fire for a while, in a really scary way. And we kept pushing forward, and our focus predominantly, once we weren't getting any support trying to get the citation set up, was really on getting the funds out to make sure that people could get access to care. Because ultimately, we're trying to prevent people from dying, and for being able to get into whatever recovery means to them. There's plenty of studies now showing that, Measure 110 did not contribute to the overdose deaths. That was fentanyl. It did not contribute to homelessness. That was kind of the eviction policies that went away after COVID. But the narrative was so strong, and people had such strong feelings about what they were seeing. And most people wanted to forget about COVID and the lockdown that we had just gone through. So it's hard to really pull apart what lessons are from, can we glean that are not COVID related? Because there's a lot that I would say we should have done differently, but we couldn't because of COVID. And so it doesn't matter. We did what we could do. The policy itself, when we went through the first legislative session and created Senate Bill 755, which really laid out the full framework for 110, that was really good policy. And it was a very thoughtful, good table of folks coming together that were coming from very different sides of perspectives, community corrections and youth corrections and addiction docs and criminal justice advocates. So we created a thoughtful, good policy. Implementation is a whole nother beast. And when you don't have buy-in from kind of the top, you're pushing it a boulder up a mountain. And I think, one of the biggest differences is Portugal had that buy-in at the top. And they were able to then say, okay, here's what we're going to do. And then all the agencies followed. We had kind of the opposite of that. We had the buy-in from the bottom. And then, and the top was at best trying to handle all the other crises coming at them. And, for those of us who are either in recovery or work with folks who use drugs, we know that we're not the top priority for most policies, right? Where it's an extremely stigmatized group, and people don't want to put themselves out in front of that issue.
I mean, in Portugal, you had Antonio Guterres, who's the president, supported that, and he's gone on to be the Secretary General. So it's a positive thing to support, I guess.
Yep.
What a question here, and would encourage anyone to pop in more questions into the Q&A. But from one of our students, and so getting support from, what are the lessons that other countries or jurisdictions can learn that if you were to go through it again, what would you make sure existed? Getting support from the top, improving the implementation process. What else do you think were things that your partners learned from this?
I mean, I think one of the things that we learned actually I took a delegation of 24 people to Portugal in the fall, including legislators. And one of the biggest key lessons that we came from that was the, importance of cross collaboration between agencies. And, we can say that it's important, but when you don't have it and you get back home and you're like, there's no cross collaboration. We can't even, figure out how one agency is doing something differently than the other.
Especially with law enforcement, I imagine. Like,
Yeah.
where does that sit?
Well, law enforcement, and then you're also adding health, and I would say that those conversations need to happen as it's going, and maybe before, which makes it hard with a ballot measure, because first you have to get through the campaign and make sure that that becomes the policy. And to be fair, this policy wouldn't have passed in the legislature, probably for another, who knows, decade, 2 decades. So the ballot measure is great for getting it passed. The problem is you don't really get the buy-in from the legislature or from the governor and the executive branch that you need. So you need to, I would say, if you're running a ballot measure, it's really important to find ways to include them in the policy drafting and the policy development, because they're going to be the ones held accountable to the efficacy of the law. And you need them to take ownership of it. I also think that, we need to do a better job of just kind of educating folks on the harms of criminalization and why it matters to really stand up for this work. And and recognize that everything is stigmatized. So we also faced a lot of backlash for harm reduction during this implementation. And there's just basically too many things to try and defend at once. So I also think that if jurisdictions are doing this, Portugal again has the right intent of looking at this from a harm reduction lens, and going out from there. And Portugal has, plenty of things that they could also be doing better, but they have been successful in holding on to this and having a sustainable model. You look at British Columbia, who had a year of kind of development and implementation and also government buy-in. So I do think that that is a key piece that maybe it would have been different if the executive branch wasn't facing as many barriers as they were, and crises. And it's important to have the buy-in and the support for these types of issues at the top. And so really building out champions within your own local communities of drug policy, and decrim, and having them understand the true implications and the true costs of criminalization on communities.
And so the ballot was supported by 1.4 million Orangonians. That's Oregon. Yeah, and but voted no by 9 million. But in the legislature, it was 50 or so against, for repealing it, and 7 against. So yeah, this real mismatch of the people's will and then the legislature changing. And a question from one of our guests is, perhaps one of the things that contribute to that is a very visceral nature of these open air drug markets. Did they exist before, or were they exacerbated with needles and the visual imagery that people have and against decriminalisation? Was there any way to mitigate against that, or to tell a different story around that to, I guess, not have this repeal happening?
So I mean, I'm not a fan of the term open air drug markets just because it feels like it's saying something much bigger in our sense. Were there people dealing drugs on the corner? Yes. They're open air and they are marketing back and forth. So it wasn't like these large bazaars where people were selling drugs all of a sudden in our city. And I think that that's important because that's a little bit of what that elicits in your brain, and the media sure planted that. And we've had media here saying, so where's your Skid Row? I don't understand. And the reality is that I know I keep going back to COVID, but our homelessness population increased by 23% because of evictions. So we have more people living on the streets. It is more, human suffering is more visible. And you have folks who, the new drug is now fentanyl here, whether they want it or not. And, that meant that people were using in groups. And, on one hand, if you're a harm reductionist, you'd prefer somebody using out in the open than in a tent because they're more likely to survive. So that's, that is real. And that is part of the lack of response to the overdose crisis. It's not about decriminalizing a small amount of drugs in my pocket, right? Having a gram of heroin no longer be a misdemeanor is not what's going to cause the ripple effect of what people saw, but local leaders saw a scapegoat that they were able to jump on, and that made it was easy. Right now I'm doing my job, but like that law you guys passed, that must have been, and you're like, oh, so putting $300 million into treatment and recovery services and making it, not a misdemeanor to have a gram of heroin is now what's caused skyrocketing homelessness and overdose death rates. It doesn't make sense. And that's why none of the data supports the claims, but that's not the world we're living in anymore. So I would love to have, I don't know, every city I know of on the West Coast is grappling with public drug use because we as a country haven't embraced the idea of overdose prevention sites. When we were in Portugal and the legislators and everybody were asking them, what do we do about public use? They said consumption sites. And it was like the most matter of fact, like, of course.
Yeah.
And our folks were like, oh, no, there's no way we could politically do that. But if we were solving for the overdose crisis and solving for public use, then we would have just put that $200 million into overdose prevention sites and training folks up to respond to overdose deaths. But that's not what was happening. It was more of what that question, is like, how do we stop open air drug markets? That's where you start bringing in like, well, we need law enforcement to create order. You also had a law enforcement that was getting away with saying we can't do anything, which was not true, but it kept leading and moving forward to kind of how the electorate and the public was feeling. We can't be people, they can't make us feel safe anymore. But that's for a lot of different reasons, including a disinvestment in policing. Whether you agree with it or not, there aren't enough people to respond to the actual crimes and violent crimes than drug use.
Do you feel like it's, decriminalization in the US is maybe 5 steps forward. Do you feel like with the, the reverse of policy, it's, 2 steps back, or is it back to square one? Or, how do you conceptualize that paradigmic shift?
I mean, we're still kind of grieving and reeling from it, but I would say that we're not all the way back to the beginning.
Yeah.
Especially not in Oregon. I mean, Oregon, we didn't go all the way back. So they went from a class A misdemeanor now to a unclassified misdemeanor, which is less jail time, no fines and fees. It offers a lot of off ramps. I don't agree with any of it, but it is less harsh than what we had. And the conversations we're having in our state are so much more progressed than when we started 3.5 years ago. You know, people are talking, even the most conservative legislators on the floor of the House and Senate were saying, we know jail's not the answer. We need to get treatment. So people, that shift is happening. The question is, how do you do it? How do we get more people into services without coercion, that need the services and that they're the right services for folks, and really enable, you know, and make sure that police aren't social workers and they're able to go, you know, do the work that they need to do when it comes to violent crimes and keeping our communities safe. Accountability doesn't, our only tool for accountability doesn't have to be jail and criminal punishment. And I think that that's the conversation that we need to have as a country and as a state, is accountability can look really different, and can be more effective when it's from your family and your friends than when it's from a system that the minute you get out, you're going to go back to doing whatever it is that you want to do.
And thinking about the context now, and you know, thinking of your partners in law enforcement, this is a question from one of the participants, law enforcement and the legal system, how are they feeling about it? You know, are they relieved that they can go back to doing their job as usual, or, you know, would they want to have another crack at it in, you know, a different way, better resourced, and this is how it should be designed? What's the conversation on the ground there?
I mean, I think the conversation depends on who you're having it with. Like all of us, we're not a monolith, right? I'm working really closely with a police officer in Portland, where we've created, along with a peer-run organization, kind of a pilot project to respond, you know, how do police respond to someone who's using drugs on the sidewalk? And so we said, well, we can send outreach workers if they want to get help. And so they're now calling us and saying, okay, this person wants help. And then we dispatch some outreach workers who can then start working with them.
Right.
So that law enforcement, you know, is seeing real results and feeling better about the work they're doing, because they don't want to be doing, I mean, they tell me, I can't arrest my way out of this. I don't want to be doing this. It's a waste of my time. I'm not helping the problem. And it's hard. I think they also say, I want tools. And so how do we build tools that aren't necessarily harmful, but can really create these bridges and these pathways to having the right response to somebody using drugs on the sidewalk? Somebody using fentanyl on the sidewalk is not the same as somebody punching somebody directly in the face, but that was the same, you know, criminal penalty that we were insisting on. So how do we actually have real good conversations, not just rhetoric out in the community about, you know, law enforcement doesn't know where to send somebody, and that's not their role. They need a number to call. They need someone to come out and kind of swap with them, and be able to, and that person is going to get much better care when they're, you know, when a peer who is trained and has that lived experience can actually meet them and say, okay, what do you need? Let's see if we can get you into a detox bed. But the realities on the street in Portland and across Oregon are, even when somebody says, yes, I want help, we don't have the services for them. And so this isn't a, we need to go back to punishment. We don't have the public defenders for them either, if they were going to go through this magical system that's going to get them placed in treatment. So I think maybe this has created more of a conversation, because I think law enforcement would agree this is not the right answer. So how do we come together and actually find the right answers together, and transition to a system where it really is addiction and harm reductionists and recovery folks working with people who are struggling on the street, and law enforcement walking away and moving on to much more important issues.
It seems, I mean, you kind of need a multidisciplinary approach to this particular form of law enforcement, you know, like, so you don't need a, you know, a harm reduction specialist or a nurse or whatever to go on the burglary, you know, kind of those areas. But in this area, it's absolutely required. Even just looking at the inventory of like the police handing the citations out, it's like they didn't know what to do, like
They're like, here's a
someone's
card. I
someone's
think
passed out, they're like, oh, here's a piece of paper, like it's sort of
Mhm.
kind of strange imagery, but at least I guess those connections, there's more of a space for them to be created now as a result of this work that's happened.
And we would have never had those conversations had we not gone through this together and against each other. And so that's why I don't know if it's 2 steps back, 3, like I think it's gonna, we'll see. But ultimately, if it can create more conversations and more thoughtful ways of working with folks who are struggling, then that's a win.
Right. Another question here is, what unanswered research questions do you still have about the policies of decriminalisation and barriers to accessing treatment and capacity and infrastructure?
I mean, I think that's the research question.
How?
This is like a classic students and researchers. Yeah, I mean, I think barriers and access, there's some real basics right now that we know, right? If it doesn't exist, that's a barrier. But then what are some good systems out there that are connecting people to care much better? And building out culturally and linguistically specific care in a much more sustainable way. I think, we're now as Oregon are working on, these deflection programs that the new law just created, and trying to kind of come up with
Lemonade.
and trying to figure out like what are the best versions of those. I think our pilot project that we're doing with the police right now is a great, version of deflection. And so a lot of this is just about local communities working together to come up with their own solutions. You just need to have it be a robust table and not just kind of the people because then you're not going to learn. And that was one of the biggest lessons we learned in Portugal, was just the people that we brought with us, having those rich discussions after talking to the government officials and the treatment providers and everybody else, and being able to kind of wrestle with it together was really powerful. So creating more of those spaces. In terms of research, I think, there's so much research being done in Oregon around kind of what happened and what did Measure 110 impact and what didn't it impact. And I think that's still going to be an important conversation. It'll be interesting and important to be following the data on who gets deflected, because now it's not mandatory. So it's optional. So I could stop one person for having drugs and deflect them to services, and the next hour I could decide to take them to jail. So who are cops taking to jail and who are they deflecting? And, kind of looking at that data is going to be really important.
Absolutely. And we have a little pup there that looks like he just walked in to get his walk, and then look at that sad face.
That sad little thing.
So we'll wrap up with one last question. What's your what's your vision for the space? What do you see down the road? What would you love to see, having learned and knowing what you know now, in 5 years' time? What does drug policy look like if you are successful in kind of reforms in this space?
I mean, I truly believe in decriminalization. I think that it is absolutely the right next step. And so it's really about helping jurisdictions figure out what do they need to get there, and then also layering that with a national conversation around how do we do that federally, which obviously we've got a really long way to go. But change can happen quickly. And with the different crises and people's awareness of addiction, and the stigma and the issues and the behavioral health crisis that we're in, we could get there quicker. I think that, for me, I'd like to see I'm all about destigmatization and making sure that we are really pushing on, people need to really understand the harms of criminalization so that they can be on board for the hard, messy work of implementation. It's not just going to be a simple scrub. So I'd love to see that North America gets, is on the path or in its, first year of implementation for full decriminalization and real user amounts, not the small amounts that Oregon had to do.
Amazing. Tera, thank you so much for sharing your wisdom and experience with us. It's been invaluable. And yeah, congratulations on the hard work that you've done so far. You're really leading the world. So we're very inspired to see what you're doing. So thank you very much.
Thank you, and congratulations on finishing out your term. And yeah, Cookie's ready for her walk.
Thanks so much. Thank
All
you,
right,
everyone.
take care. Thanks.